Well, hi everyone. I'm Daniel Williams, Senior Editor at MGMA and host of the MGMA Podcast Network. I'm excited today. We have a special panel discussion, and this is related to our 2024 MGMA Future 5 Awards. To give you just a little bit more about that, the MGMA Future 5 Award recognizes professionals in the first 5 years of their healthcare careers, and they're all people who are making a significant impact in healthcare. So we have a lot to cover today, and I want to get to hear from all of our panelists. So let's start. We first have Kyle Hussey. He's Chief Operating Officer at Colorado Surgical Affiliates. Kyle is fairly new to healthcare, but he has already implemented several service lines that have helped keep his practice viable during challenging times, including a lump and bump clinic and a chronic care management and DME dispensing clinic. Kyle, welcome to the show.
Hey, thank you. I'm glad to be here.
Yeah. Next, we have Jonathan Renzi. He's clinical manager with Lifespan. Jonathan's background as a registered nurse has been instrumental in his focus on patient-centered care. Also, he is focused on operational efficiency and fostering collaboration within his practice and across the broader healthcare community. Jonathan, I want to welcome you in as well.
Thank you, Daniel. Excited to be here.
Next, we have Anastasia Delaney, Operations Coordinator at Mortensen Dental Partners. Anastasia has dedicated her career to addressing gaps in rural dental and nutritional care and has led significant community service initiatives in Kentucky. Anastasia, welcome.
Thank you so much, Daniel. I'm excited to be here.
Yeah, we're excited to have you here as well. Next, we have Disha Sawhney, Service Line Manager at Fox Chase Cancer Center. Disha has been instrumental in establishing and enhancing 2 oncology service lines. Disha, welcome to the show.
Thank you, Daniel. Really grateful to be here.
Yeah, great to have you here. And then finally, Samantha Baker, Healthcare Compliance Analyst with Cherry Beckert. Samantha is a standout student in healthcare management studies, and her leadership and entrepreneurial thinking have earned her high praise in both the academic and the professional settings. Samantha, welcome.
Thank you, Daniel. Excited to talk to all of you today.
Great. So we're going to cover a lot of things here, everybody, and just want to thank all of you for being part of this panel discussion, and also congratulate you on being Future 5 Award winners. That is so neat, and it's so integral to the growth of healthcare to have leaders in their early career as you all are. So we are going to start. This isn't like the Marvel superhero side of things, but we love origin stories. We love to hear how you got started in your career. So Jonathan, let's start with you. As someone who has that clinical training as well as a registered nurse, what drew you into the management side of healthcare? Talk about that part of your journey.
Sure, Daniel. So I love this question. I get asked it a lot as well. As a nurse, I'm able to care for patients one-on-one and have that direct on-hand nursing care. And I've been able to experience firsthand the challenges that the frontline staff face with patient care. This ranges from staffing shortages, supply shortages, whatever it may be. And I found myself thinking there has to be a better way to do this, or a better way to help streamline this process. So one of the key turning points for me was I began to understand the power of leadership in healthcare settings. I realized that the systems in place, whether it's scheduling, resource allocation, patient safety protocols, they're all crucial to delivering care. And the more I delved into understanding that problem, the more passionate I became about coming up with a solution. So I was driven by the opportunity to be an advocate for both patients and staff. And the staff are a large part of what I do and why I do it. Coming from areas that staffing was an issue, I'm able to supplement where I need to, and also be able to empower my staff to do the best that they can and to care for patients as well as they can. Additionally, I realized that in a leadership role, I could mentor and support other nurses as well as medical assistants, the secretarial staff, referrals. There's a lot of different outlets and departments that I could go into and help them deliver better care. So ultimately, moving into management gave me the ability to combine my clinical expertise and with strategic thinking to influence how care was delivered on a larger scale. In that sense of being able to drive meaningful change, both for individuals and for the system as a whole, is what really inspired me to pursue this path. And I'm so blessed to have the opportunity to serve my team as a leader.
Yeah. Well, thank you so much. Appreciate that. Next, let's hear from Samantha. You have excelled both academically and professionally. What led you to healthcare in the first place? What was that spark that got you into healthcare, and how have your studies shaped your approach to leadership?
Yeah, definitely. I've always been super comfortable in healthcare. My brother has a massive heart issue that he's had since he was one. So as a kid, I was blessed with the thought that hospitals and clinics were a place where people got better. So I've always had that kind of positive view with healthcare. As I kind of grew up, I thought I wanted to be more of a provider, but when I stepped into more of a schooling atmosphere, I found that my place in healthcare was more of an administrative side. So I kind of gained that respect for those who offloaded work off of providers so that they could solely concentrate on their main goals to make patients better. So my studies have always kind of revolved around healthcare focus, and I've always had this goal that I've wanted to add myself to that equation of making others see the beauty of what healthcare could be. So that's definitely where I've started and kind of where it's led me down this path.
We're glad you are on that path. Thank you so much. Kyle, as I mentioned earlier, you're not new to a career or the business world, but somewhat new to healthcare. What was that like making that transition? Because we've all experienced it, that healthcare is its own thing. I mean, certainly you can translate some aspects of it as a business, but you've come in from different fields. So talk about that, transitioning from another sector.
It was a different world that I came from. I was overseeing operations and sales for a big wireless carrier in the Southeast Territory. And that industry sort of reached maturity, and I got to a point where I didn't feel like I was making a real big difference anymore. And so at the time, my brother-in-law was going to PA school to be a physician assistant. I thought that sounded pretty interesting, so I started kind of exploring that a little bit. And that's actually how I got into. So I started working in the clinic that I'm at just to meet patient contact time, so I could apply to PA school while I was taking some of the requisite courses. But the practice manager at the time, she's now our CEO, she recognized some transferable skills and asked me if I could, help out in different ways on the business side of things. And so I started off just sort of managing our in-office dispensary, which we use for like oral oncolytics for some of the cancer patients. And one thing kind of led to another, and I ended up going down the business route. And but it's very different. There have been some challenges coming from what is a very sales-centric organization to one that is definitely not, and an organization where almost the entire workforce is what we call producers to one where the majority of the workers are support staff trying to clear out hurdles and obstacles so that providers can see patients and bill for that service. And so that's been one of the big challenges, switching industries is understanding that, and understanding that the staff is motivated by completely different things.
Thank you for sharing that. Anastasia, let's hear from you next. Talk about your role. You are have a full-time role at Mortensen Dental. You've also branched out and concentrated on rural dental needs as well. Talk about the kind of work that you're doing at Mortensen and some of the other focus that you have in your day-to-day role.
Absolutely. So, growing up in a rural area where healthcare, especially dental care, was often inaccessible, I experienced firsthand just how much it impacts a community's well being. Limited access to care combined with food insecurity really shaped my understanding of the unique challenges faced by rural populations. That's what really drives me today. In addition to my full time role as an operations coordinator at Mortensen Dental, I actively seek out opportunities to improve rural dental care and food insecurity through volunteer work. One of the things that I really love about working for Mortensen is how closely the company's mission and values really align with my own. Like I mentioned, I really like to seek out volunteer opportunities to kind of bridge that gap. And Mortensen has a big focus on giving back to the communities we serve. Each year, we partner with a local church in Shelbyville to offer free dental services, and I really enjoy getting to be hands on as a dental assistant during these clinics. That direct involvement fuels my passion to ensure that our operations continuously find ways to expand care to those who need it most. And I carry the mindset into my daily work, always looking for ways that our team can bridge the gap between those in need and the care that they deserve.
Yeah, thank you. Finally, Disha, let's hear from you. What drove you to healthcare leadership in the first place, and what excites you about being on that management and leadership side of things?
Thank you, Danielle. The person that influenced me the most would be my grandmother. She was a gynecologist, but she was also diagnosed with end-stage cancer. But the passion that drives me to healthcare stemmed from my undergraduate thesis, where I worked with Down syndrome kids in rural southern India. And that was my first glimpse at looking at how the disparity existed, and felt a very strong calling to deliver to a sector that went beyond direct patient care. And that till today really drives my passion to work and make a difference in healthcare administration. Coming to my something that excites me about my role as a service line manager is working with two amazing physician leads and an interdisciplinary team of experts, and just, making those process improvements and making sure that we're delivering the best possible care to our patient population, which is like they're going through so much already. Like, it's our job to ease it out for them. And I'm really grateful that I play a very I play my part so that their process and their care is much easier.
Thank you. So we heard a bit about some of the origin stories or the motivation or the purpose of what y'all are all experiencing, what got you to healthcare and what you're going through right now. The next topic we want to cover is really looking at healthcare challenges and the opportunities there. It's no secret to any of you or any one of our MGMA listeners right now that there are a lot of challenges in healthcare. But there are also those opportunities that can be carved out as well. All of y'all are doing that. So let's learn about that even more. So Samantha, let's start with you. You have worked in both the administrative and in patient-facing roles. What are you seeing as some of the largest challenges that healthcare faces right now? And how can healthcare leaders address these?
So in my experience, I think one of the biggest healthcare challenges that we face is kind of like the ever-changing regulatory environment. As someone who works like closely in HIPAA compliance and then has also worked for various like healthcare systems, I've seen firsthand how challenging it is for like providers and organizations to stay compliant with delivering quality care and navigating regulations like Medicare, Medicaid, and new billing processes that can very much like overwhelm clinics who are rapidly growing or transitioning into new systems. I feel like we saw a lot of this during the COVID-19 pandemic. I feel like every single part of healthcare was affected, but this part was definitely something that we didn't expect. Another critical issue is patient access to care. It's hindered by like overly complicated scheduling, authorizations, and pre-certifications. in my role, I've seen where systems and have helped with systems that need to revamp how they're doing pre-certifications and authorizations with multiple different clinics, and how improving that and improve can lead to patient access and reduce delays in care. So streamlining those type of administrative processes and ensuring that the teams are well trained in insurance protocols and EHR systems, we're able to see like those barriers kind of minimize and have our providers, like I kind of spoke on in my origin story, focus on delivering care and not be kind of boggled down with their paperwork. So I really think that healthcare providers need to focus on reducing administrative burden on patients and staff by investing in good training programs, adopting technology that helps streamline workflows, and building like strong communication channels between departments. If leaders kind of prioritize staying ahead of those regulatory changes, it's easier. I've seen that it's easier to navigate teams efficiently and ensure like compliance without compromising any type of quality care.
Thank you for sharing that. Disha, let's hear from you next. Now, your expertise is in rolling out new cancer treatments that also intersects with the broader operational efficiency and service line development. Talk about that, how that has helped address some of the challenges out there, but also carved out some of those new opportunities that we spoke about earlier.
Yeah, no. First of all, I would like to echo of everything Samantha said. That is 100%. I think most health systems face those challenges. And healthcare is so dynamic. So we're always going to have new challenges to tackle and new opportunities to make a difference. The biggest challenge as a service line manager, I would say, is often coordinating and operationalizing new workflows into existing protocols, because it's so important to make sure, like, everyone's moving to a newer protocol and that they're being managed efficiently. Most of my work is operationalizing workflows to support our, care providers, reducing their burden on administrative processes. One big focus or challenge that I would like to mention is I like to prioritize patient education, because ensuring that they're receiving appropriate documents for their care that outlines precise information of their risks and barriers, so that it empowers them to make informed decisions of their care journey. I think that's really important. And sometimes that tends to be quite challenging in today's world. While a patient can go look up treatments online, and sometimes it's very misleading. So that's a very challenging aspect of my role, is sometimes making sure that we give out the correct information and our patients are hearing that information the same way that we intended to.
Yeah. All right. Thank you. Kyle, let's hear from you next. Balancing financial pressures and patient care is critical. You talked about the passion you've brought to your work here in healthcare, very different than in the cell phone world and mobile world that you were in previously. Talk about these service lines that you've introduced and how it's helped you navigate any challenges that you've encountered.
Every service line that we look to bring on, and any kind of process change or anything like that, we kind of put through a framework of questions to see if it really makes sense. We ask, first of all, does this meet a financial goal? Does this meet a clinical goal? Does it meet like an operations or a workflow goal? So if it's something that is going to help the doctors with medical decision making, or maybe give them better information, or get the information to them faster, or that sort of thing. We ask that, but then we got to look, well, is this going to be a viable service line, or is it going to cost so much money that it's just not doable? The other thing that we look at is, and this comes into play for sure with some of these service lines, but also things that aren't really necessarily service lines, but we're looking at like operational efficiency or workflow. So is there something that we can bring on that will help us, reduce the burden, increase throughput, patient throughput, and can we do that in a way, again, that's not going to cost the practice so much money that it doesn't stay viable? And so when we look at different service lines, we've brought on, like the catheter service, or we've brought on PCR. So PCR on urine tests, so that we're not sending out cultures and patients aren't needing to wait for 4 or 5 or 6 days for a result back. We can get them pretty quick, but it's very expensive for us. So we had to look to see, well, is this going to make sense financially? And so, it's just a balance of all those. And when we can find something that meets, 2 or all 3 of those, it's kind of a no-brainer to pursue.
Yeah. Thank you for that. Anastasia, let's hear your voice on this particular topic. Now, you talked about rural healthcare earlier. It does come with its unique obstacles. What can you share with us about working with those rural patients, bringing improved access to care, particularly in dental and nutritional services? What do you want to share about that?
Yeah, so in my administrative role, I can definitely see the lack of access to comprehensive care, especially in underserved and rural areas, as one of the biggest challenges in healthcare. Many of these communities struggle with limited access, not only to dental or healthcare services, but also education about the vital link between oral health and their overall well-being. This disconnect can lead to long-term health issues that could have been prevented with proper care and information. So to address these challenges, I'm involved with initiatives that focus on expanding access to dental care in these underserved areas. For example, participating in free dental clinics, partnering with local churches and community organizations in order to bring essential services to these areas. And then through my work, I work closely with our teams to develop communication strategies and educational content aimed at helping patients understand the broader impact of dental health. By collaborating with these various departments and utilizing community partnerships, we're working to bridge the gaps in care and promote a more integrated approach to overall health.
Okay, thank you. Jonathan, you will clean up on this particular question here, but you do, again, have that clinical background as well. Patient-centered care is at the heart of what you do. Talk about that. Talk about any improvements you may have implemented there at your practice.
So healthcare is definitely a rapidly evolving field. There's both longstanding issues and new challenges constantly shaping the landscape. From staffing shortages to healthcare disparities, these challenges are complex and they require a multifaceted approach. So one of the major improvements that I have had in our clinics is our access to care. So we all know that access to care is a very large issue in healthcare. It's unfortunate because patients deserve care when they need it. So having that in mind, we streamlined our internal referral process. So we have express referrals now, so they come directly through our medical records. The referring provider can talk with our specialist and decide whether a referral is needed at that time or whether this can be handled with the PCP or referring provider. Also, hiring the right staff. Ensuring that I hire the right staff is very important to me. I take my time with it, I'm thorough with it, and I wait to find the right person. And as a result, we have formed a very strong referrals team, and they have allowed patients to receive very timely care from our specialists. And I've also prioritized staff engagement and rewards and recognition. So recognizing the staff that are doing an exceptional job, that are going above and beyond for their patients, and just supporting them in their roles and fostering a supportive work culture is very important to me as well. So we've created an environment where nurses, medical assistants, secretaries, where everyone can focus more on the patients and delivering quality, compassionate care. These improvements have collectively and ultimately led to enhanced patient outcomes, better communication between staff and providers, and a more collaborative approach. And additionally, patient satisfaction scores and surveys have reflected this an increase in accessibility and overall quality of care.
Yeah, I want to thank you for that. I want to thank all of you for the answers on that particular topic, because it really got into what we're going to talk about next, which is leadership and innovation. All of y'all were touching on aspects of that in that previous question. So when we think about the Future 5 Award, we're really looking at the future and current leaders in healthcare. All of y'all are bringing that to your practices. You are emerging leaders in the healthcare space. So Kyle, let's start with you. You have developed new service lines while fostering leadership within your team. Talk about what that looks like, addressing leadership within the team and how you have approached that.
First of all, I don't think we can grow, we can't scale the business without having good leaders in place. And we have to be able to grow. The need is increasing, not just in our area with population growth, but also the demographic, the aging demographic in our area creates a demand, and we have to be able to grow and kind of do more with less. And one of the challenges that we face with any kind of changes is, we run pretty tight workforce margins, and so there's not a lot of time. But we recognize that leadership development is an important thing to be able to accomplish our goals. So we started separating out time every month just for our supervisors, the people leading their departments, for some kind of running the practice kind of details, but also general leadership topics. And we always review a book. We review with all of our leaders, Hardwiring Excellence by Quint Studer. If everybody's read that, fantastic book. We also review Crucial Conversations, developing those sorts of conversational skills. We also review different articles, like we've started reviewing from Harvard Business Review, articles from Harvard Business Review that apply directly to what we're trying to achieve. So we've started implementing those, and then semi-annually, every 6 months, we have a leaders retreat where we really go into more detail about what we're trying to achieve as an organization, go over, provide clear vision and transparency in what we're trying to achieve and how everybody plays a role in that. And that's been really pretty successful.
Yeah, thank you for sharing that. Disha, let's bring you into this conversation next. You've been involved, as we mentioned earlier, in large-scale innovations like cancer treatment. How have you brought leadership principles and strategies into that field?
Personally, having a very open growth and continuous learning mindset is really important. It's a very important skill to have. And that really persuaded me to get a doctorate degree. So that's what I'm in my second year of my doctorate right now. But the two leadership skills I would say that have really helped. Number one is listening. I think it is so important to pay attention. In today's world, we are in so many Teams calls, Zoom calls, and so much gets lost in translation. And we forget that our patients are they're the main subject, right? Like that's the bottom line. Like we have to focus everything we do for our patients. And then the second practice I would say that has helped me is being organized. I think knowing how to prioritize your work is so important because we're always going to keep getting projects coming our way. We're always trying to tackle some issue. But then knowing how to prioritize and which efforts need attention, I think that's so important. And those are the two leadership skills that have always helped me in my past roles. And that is what even, helps me right now to face all the challenges that we do in our workforce.
Yeah, thank you. Jonathan, I'll ask you next about this particular question. In reading about you and your nomination, learned about how collaboration is very important to the work that you do. So how do you bring collaboration? How do you bring teamwork into that framework of overall leadership at the practice?
Yeah, so as a registered nurse, obviously, on the inpatient floors, communication and collaboration is key. So ensuring that you're working alongside your peers with other nurses, the doctors, CNAs. If you don't have everyone working together, patient care collapses, and staff get very frustrated. So taking what I've learned in those experiences into my clinic, I've been able to promote teamwork and collaboration as a fundamental resource to us to ensure we have a thriving culture and environment here. So ensuring that I have open communication with my staff and team, ensuring that my door is always open. I'm often out there doing things with the staff and talking with them and ensuring they have the tools that they need to care for our patients well. So by ensuring that we have a culture of safety here, we do regular team meetings, regular huddles. We're often shouting staff out. And I just make it a point to be an approachable leader. I want someone to feel comfortable coming up to me with a concern or a problem and knowing that there's not going to be repercussion or there's not going to be punishment. There's not going to be any formalities. It's just going to be, let's solve this together, so that you feel encouraged by it and you've also learned a lesson from it. But I've also learned a lesson from what you've brought me because I'm encountering these things for the first time as well. So just knowing that I'm on the same team with them has really helped. So recognition, like I said in the last question, is a large part of what I do here, ensuring that the team feels that their contributions are valued, and that we foster a sense of accomplishment within the office.
Yeah.
And lastly, teamwork, collaboration are at the center of workflow, like I said. So this is essential. No one wants to be left alone. No one wants to be working alone. No one wants to feel as if they're alone in this. So collaboration leads to fewer errors, quicker decision making, improved outcomes, and just allows us to work together to ensure patients are cared for well. So when patients and staff are on the same page, they are able to work together, they're able to come to conclusions together, they're able to have an active voice in their care with the staff. And that's just really a special thing. I truly love my team, the care that they provide, and I care for them as my own. And I hold them with an open hand. And I always ensure that they know how much they mean to me and our community.
Yeah, Jonathan, thank you for that. Anastasia, as we talked about earlier, community service is an important part of your professional life. So, how do you see leadership and community engagement intersecting? What have you done there? What have you seen in that space?
Yeah, so leadership, in my view, is really about being deeply connected to the communities that you're serving. Being someone who has experienced the lack of healthcare access and now being in the position I'm in, I feel like I have a unique understanding of the critical need for leaders to really be involved, not just in decision making, but really on the ground. Um, that on the ground work is really what drives change. In my role, coordinating dental operations, I'm always thinking about how we can create solutions that respond directly to our community's needs. For me, community service and leadership really go hand in hand. It's about taking a proactive role in addressing these issues that affect the most vulnerable. And effective leadership is about being in the field and showing up for those who need it most, while also empowering other people in the organization to do the same thing. So if you're out there, boots on the ground, working with your community, and then you take that back to your offices, it's going to empower your employees to do the same. They're going to want to really drive that change because they're seeing that you're doing it. It's not just we're talking about mission, vision, and values. We're actually living them.
Yeah, thank you for that. Samantha, you, according to your nomination, I learned about you. You have this entrepreneurial spirit that you've brought to healthcare. What advice would you give to others to balance innovation with those practicalities that healthcare demands. How have you been able to do that and navigate those two spaces there?
Yeah. So in my experience, leadership qualities that like help that are most valuable to me are adaptability, communication, and like this type of solution oriented type of mindset. Healthcare is pretty dynamic and it's quickly to adjust to change when we're related to like regulations, patient needs, and organizational growth. My ability to like adapt during challenges like COVID-19 and other problems that come up kind of help me lead and receive leadership through significant changes, so that entrepreneurial like kind of thinking is also kind of like a key asset. In my role, I've seen the opportunities to streamline processes and reduce inefficiencies and ultimately improve patient care. It's not just looking at something though and seeing that it's broken, but also and helping it, get better. But it's also anticipating those future needs and the position of a clinic to help handle increases in patient volume and maintain high standards. I think leaders must constantly be asking how we can do this better while also balancing like the practicalities of healthcare regulation, financial constraint, and like high demands of patient care. So from those impacts, my advice would be to embrace innovation, but also keep that like kind of practicality in mind. I think it starts with like a deep understanding of what the current systems are and what the challenges we face, but also before understanding those type of the current system we're in before we're introducing like change. So like building those deep relationships with your team, listening to their concerns and getting kind of their buy-in on what the changes are. Change can also be like super disruptive. So also it's also really important to communicate like the why we're going into new processes or new innovations. So definitely that communication.
Yeah, thank you for that. Now, I can't believe this, y'all, but we're winding down on this particular panel discussion. But I have to tell y'all, I'm just going to stop for a moment and tell you how excited I am about the future of healthcare in y'all's hands. Y'all are inspiring. So, in our final question, we're going to have a future outlook. Y'all are the future five. Again, I made the superhero reference earlier, but it really does feel like we're in the hands of superheroes in your own way, with your own skill set and your leadership vision. So, Disha, let's start with you. Cancer care is rapidly evolving. What advancements are you most excited about that are in that space?
Definitely. So yeah, indeed, cancer care is making significant strides, especially with, artificial intelligence, AI, machine learning that helps us analyze vast amounts of data. It helps with predictive analysis and it's able to tailor personalized care. I think that's definitely exciting and rapidly evolving. But also, another significant advancement would be in the field of immunotherapy, like CAR T cells in the treatment of blood cancer. Those are two significant, rapidly advancing fields that I'm really excited to see how it's going to make changes to the healthcare state. And I see myself contributing by working with interdisciplinary teams, working to operationalize and roll out these treatments as and when they become available, so that we're able to serve our patient population and provide the best possible care to them.
Yeah, thank you. Kyle, I'll talk to you next here. You had talked about where you came from, those industries of phones, that kind of communication field, that it was in some mature stages there. But here in healthcare, you have introduced some service lines that are really in their early stages, and there's so much growth and potential there. Talk about that. What does the potential look like for those service lines you've been introducing?
Well, I think a couple of things. First is we got to continue to work with some of the payers to make sure that they see the value in the service lines we're trying to bring in. So much of what we're trying to do to reach the community and service the community is dictated by whether or not the payers see it the same way as the providers do. So we're going to continue to work through that, and then specifically of the several service lines that we are that we brought on and are working with. I think one of the big ones for us and for me to focus on right now is the chronic care management. It's really popular in primary care, less common in specialty care, but specifically in urology, they're dealing with a lot of chronic conditions, several types of cancers. Right now, we're pretty focused on prostate cancer with chronic care management, but we could be doing the same thing with bladder, with kidney, and then some quality of life conditions as well, like overactive bladder for patients would be really good with chronic care management. So continuing to focus on that.
Okay, thank you, and thank you for the work you're doing there. Samantha, we'll turn to you next. What healthcare trends do you think will have the most significant impact in the next few years, and how are you going to be involved with those?
I think one of the most exciting trends in healthcare is definitely the increase of technology and data analytics for improving patient outcome and streamlining operations. Kind of like the rise in health, telehealth, AI, and advancing data management systems, allowing us to be more personalized and then increase our quality of care and kind of break down those traditional barriers like location and access, which Anastasia kind of touched on. I believe that healthcare is kind of on the verge of becoming more patient centered than it's ever been, and these technologies are kind of allowing it to kind of better preventative care and then faster diagnoses and even more efficient treatments. So I feel like in the next few years, I believe the trend will be very much on the expansion of telehealth, integrating AI into clinic decision making, and an emphasis on patient data security will have the most kind of significant impacts. So I feel like staying ahead of these trends and continuously learning and adapting, I plan to kind of remain on that forefront and pursue more further education and staying engaged in the industry with the leaders and participating in professional networking events to make sure that we're all connected and that we're understanding kind of what advancements other people are having and seeing if we can adapt it to clients or even other healthcare systems I'm working with.
Yeah, thank you for that. Jonathan, your career has been patient-centered care. That's really where a lot of your focus has been. Where do you see that going? What role do you want to play in that patient-centered care?
Patient-centered care is very crucial, as we all know, and it's at the center of healthcare, and it should be at the center of healthcare. I know healthcare is a business as well, and that's one of the things I've had to learn is that not only am I a nurse now, but I'm also an administrator, so I have to have that focus in mind. I think that there's three big areas that we can help to improve in healthcare and advocate for, and I would plan to be a large advocate for. The first one I think is technology within healthcare. So the use of mobile phones, there's the electronic health systems on the phone that patients can use to message providers, look at lab results. I think that's going to play a very large role in allowing patients to receive access to care immediately as well. Preventative care is the next one. So ensuring that patients are being seen before there's an issue. We often see patients come in for very acute issues, and these take a very long time to resolve, and they're very expensive. And we want to get patients on the path to good healthcare before there's an issue. So taking care of their bodies, learning how to do that, so that when it comes to a specialist visit or a primary care visit, you're kind of catching things ahead of time so that they're not going inpatient for something very chronic or acute. And then lastly, I know I keep talking about it, but staffing, ensuring good staffing and effective teams is so crucial. And you can't have good patient care if you don't have a good team. That is something that I've learned. So without proper staff to patient ratios, the future of healthcare will suffer. So ensuring that on my team, I have good staffing, I have adequate staffing, my staff feels supported and that they have enough people. It reduces burnout, it reduces turnover, and creates a continuity of care for reliable patient outcomes. I think as leaders, it is up to us to ensure that we are people that others want to work for. And I really take that to heart.
Yeah, thank you. Anastasia, you get the final word among the panelists here. We have touched on rural healthcare and community engagement there. What do you see happening? What do you hope to have as your role there working in those spaces?
Yeah, I really love this question because I feel like in the dental space, there is so much going on, and we're prioritizing really reaching those more rural communities, especially in Kentucky. I'm especially excited about mobile dental clinics and the impact that telehealth services are having. These innovations are transforming how we reach these rural populations that otherwise wouldn't have access to care. Mobile clinics allow us to bring vital dental services directly to these communities, removing the barrier of like long distance travel. Telehealth, on the other hand, enables follow up care and consultations that can make a significant difference in continuity of care. I also believe there's a strong oral systemic link. So integrating nutritional education into dental visits is another approach I'm really passionate about and fortunate to work for a company that places priority on this topic. By addressing both dental and nutritional needs together, we are able to offer a more holistic care that can improve overall health outcomes, especially in rural areas. These innovations give me hope that we can make a lasting change in these communities that really need it the most.
All right. Well, thank you all for being part of this panel discussion today. That is going to do it for this episode of the MGMA Member Spotlight Podcast. Just a couple of notes here. If you're interested in being a Future 5 member in future years, I'm going to put a direct link in the episode show notes. You can click right through to that to learn more about the Future 5 Award. And I'm just going to say it one more time for all of you. I am so excited, and I feel like we are in really, really good hands for the future of healthcare with early careerist leaders such as yourselves. So thank you all for being part of this panel today, and thank all of you MGMA listeners for being part of this MGMA podcast. Thank you all so much.